Sound check one. Good morning and welcome to the Audit, Finance and Administration Committee for Thursday, December 7th. It's our last day F&A of this year. I'd like to call today's meeting to order, and just so folks are wondering, quorum is present in the chamber today. Councillor Alex Wilson, Councillor Mark Tattison, Councillor Tammy Huang, Councillor Brad Clark, and joining us online, Councillor Mike Spatafor and Councillor Maureen Wilson, and a guest in the chamber today, Councillor John Paul Danko. As a reminder, all your electronic devices should be switched to a non-audible function. That means if they make noise, stop them. We'll move right into the agenda today. The approval of the agenda is item 2. Before we get to approval, Clerk Bates, please let us know about all the exciting changes.
There are lots of exciting changes, Chair Kretsch. Item 1, appointment of chair and vice chair has been withdrawn. That item was added by accident. We have item 6, delegation requests, 2 new delegation requests. 6.1, the delegations are speaking to the Board of Health Governance for today's meeting. 6.1A is Kojo Damptey, and 6.1B is Lyndon George from the Hamilton Anti-Racism Resource Center. We have changed to item 8, the staff presentations. Item 8.2, Equity, Diversity and Inclusion Audit, AUD 23013 citywide, is being withdrawn from today's agenda and will be brought back in January. Then we also have a change to the order of the agenda. Consent items 9.1 and 9.2. 9.1 is 2023 Board of Health Self-Evaluation Results, BOH 23040 citywide, and 9.2 Governance Review Subcommittee Report 23005 from November 17th, 2023. These items will be heard immediately following the delegations.
Thank you very much for that. I appreciate it. And the EDI audit will come back on January 18th for anyone wondering specifically when. On that note, may I please have a mover and a seconder to approve the agenda as amended? See Councillor Alex Wilson, seconded by Councillor Huang. Any further discussion about today's agenda? I'm not seeing any further discussion, so we'll vote. And the vote is up. And that carries 8-0. Now move on to the next item on our agenda, which are declarations of interest. Any members of committee have any declarations of interest to declare today? Not seeing any. On to item 4, the approval of the minutes from our previous meeting of November 16th, 2023. May I please have a mover and a seconder to approve those minutes? See Councillor Tattison as the mover. The excitement on these minutes is real. Anybody else? Or shall they remain in limbo? Thanks, Councillor Maureen Wilson, seconding the minutes. Any discussion on the minutes? Not seeing discussion, we'll go to the vote. That vote's up. That vote carries 8-0. We're now moving on to delegation requests, item 6. And 6.1, with respect to Board of Health Governance for today's meeting, for Kojo Damptey, and B for Lyndon George from the Hamilton Anti-Racism Resource Center. May I please have a mover and a seconder to approve the delegation request as presented? See Councillor Tattison and Councillor Alex Wilson. Is there any discussion on the delegation requests? Not seeing discussion, we'll go to the vote. And that vote carries. We're on to delegations at this point, and I'll invite Kojo Damptey to come up and make his way down here. What I'll say is that 2 things. 1, at our last attempt to delegate on this discussion was at the Governance Review Subcommittee. We abbreviated that meeting pretty quickly and adjourned the items here. And so I've asked delegates not to repeat the content of their previous delegations on the subject to the extent that they can, but to clarify and expand is totally fine. But I'm going to give some latitude here because that was an abbreviated meeting and we didn't get to completely finish it in the way we should have. So I'll call Mr. Dempsey up, and you have 5 minutes. As you probably know, there'll be a charming little chime at about the 4-minute mark that says, hey, you've got a minute. And then at the 5-minute mark, it'll chime again. And so when you hear that chime, please wrap your comments up, and if need be, I'll just gently remind you. Otherwise, whenever you're ready and the technology is loaded, the floor is yours.
I can begin? Okay, good morning. Many of you have heard me speak on this topic before. I've been reminded not to repeat some of the stuff I've said in the past, so I will try my best to do that. So today, what I wanted to do was start from a historical perspective. So you have 3 examples of Black populations and indigenous populations in relation to health. The first is 40 years ago, the Tuskegee experiment that experimented on Black populations without consent. Second is the story of Henrietta Lacks, who was also experimented on without consent. Third is the sterilization of indigenous women here in this country, where in Alberta and British Columbia, there were sexual sterilization acts. These are historical contexts that have present-day realities. So when we talk about indigenous women in relation to healthcare, this is an article from CBC Health. This is August 20th, 2023, that says barriers like racism, distrust may be the main cause of healthcare disparities for indigenous women. When we talk about Black communities, again, this is April 2022, where in Canada, if any Black man goes for kidney results, there's something called a race factor. That is only for Black populations. And in this article, it talks about how that affects someone's possibility of having a kidney transplant. So when we are talking about restructuring a board of health, we're trying to bring this historical perspective to the current things that people are facing when it comes to public health. As I said, I have spoken on this issue. Lots of community members have spoken. Those are the numbers from 2021, 2023. And now, the city did its own consultation and survey. And what would you know? The whole year, there's been 43 projects on Engage Hamilton. The third was the restructuring of the Board of Health. That was the amount of engagement that was seen on your own platform. So people are interested in this discussion. People are concerned about the impacts of health decisions on their day-to-day. I won't read that one. That's from a past delegation. There's been questions about, well, if we do this to the Board of Health, is it going to happen to other standing committees? That's the board of, on the left, that's the Board of Health for Toronto with councillors and health experts. doctors, nurses, community members. That's the Board of Health for Chatham-Kent Board. Again, they even have an indigenous representative. But in those municipalities, their public works board, their finance boards are made up of councillors. This is specific and germane to boards of health. So, your own report says it is clear. It's clear as water. So, the time is now to make this decision. All the things that have been requested from this council has been met. Today, there's going to be a presentation, and right now, the answer is clear as daylight, is clear as the water in this glass. So I rest my case. You don't have to listen to me. You just have to look at the report, 928 responses. My time is done.
You did have a few seconds left, I think, but that's okay. You're able to stop whenever you wish. On that, are there questions for the delegate? Oh, yeah, I see Councillor Danko.
Thank you, Chair. Just noticing your slides, you have contact and logos of McMaster University. So just so I'm clear, you're here representing McMaster University?
As I said the last time, I am a sessional instructor at McMaster. There are lots of professors, instructors that talk about things. I teach in community engagement and Black studies. That's germane to some of the things that I'm teaching, and that's why I'm talking about it from that perspective, as someone that teaches a course around community engagement and Black studies.
So this is your perspective on behalf of McMaster University.
Again, through the chair, like any other professors that come here to present on topics that they either teach or research, they have that affiliation. If a University of Toronto health professional came, they would say they are an instructor or professor from the University of Toronto.
I don't want to belabor the point, but the impression that you're giving is that you are here presenting to the Corporation of the City of Hamilton the views of McMaster University.
Yeah, to be fair, and I would ask you not to respond. I don't think we should debate the delegate on the subject. I think he's answered the question that you asked in the way that he thought was appropriate. Said he represents McMaster in that specific context.
Okay.
Let's leave it there. Other questions?
Nope.
Councillor Maureen Wilson?
I'll follow the lead of the chair, but I would like to remind my colleagues that last council, we did entertain a number of McMaster professors who are appearing here as individuals, but noted as McMaster professors because they were speaking, their delegations were informed by their very profession and their focus of expertise and study. And I didn't hear any objections then. And that's all the comment I'd like to offer. Thank you.
Okay, I think that was some kind of point of order, but did you have questions for the delegate at all, Councillor Wilson? You didn't have questions for the delegate. Okay, any other questions for the delegate? All right, I have a question. I'll just pass the chair to Councillor Huang, the vice chair, if that's okay. You've been actively following this issue for a number of years now, and I'd be interested in knowing how you've seen the discussion change from if you've seen a change, if not at all, if you've seen more engagement, less engagement. When we started having these discussions in, I think, 2020 or 2021, what's your impression of what's changed since up to now?
Through the chair, I think one of the things that have changed is that now residents want to know how the Board of Health impacts their health outcomes on the day-to-day. So at the community consultation, we did let residents that were there know about the composition, and they were shocked that there was no health expertise on the board. So they provided their input, and I think, again, we are seeing now, obviously with what went through with the pandemic, that there's a connection between health outcomes, what happens at the Board of Health, and how public health also impacts their day-to-day life. I'll give you one example, and this was during the pandemic. Obviously, working with public health, they had the vaccine ambassador program. And so when I was the former ED of Hamilton Center for Civic Inclusion, we used to canvass King Street and talk to people. And some of them didn't even know we had a public health department or agency. So we had to talk about the role of public health and why they should be vaccinated, where they can get health information from, what public health does, what their responsibilities are. So now that folks are tuned in, they want to make sure that decisions really impact their health outcomes.
Thank you. Councillor?
Thanks, that was my question. I don't see anybody else on the list. I'll take the chair back, and we will thank you for your delegation. And if it's okay, we will receive the delegation at the end with the other one at the same time. And call our next delegate down, Lyndon George from the Hamilton Anti-Racism Resource Center. And same thing, all the same dings will appear at the same times, and you can start your presentation whenever you're ready. You've got 5 minutes.
All right, good morning, everyone. We're back here again having an important discussion about restructuring Hamilton's Board of Health. You've heard from Coach Dempsey the importance of the work in this discussion, providing context that oftentimes we don't talk about in community, the historical legacy of health inequities and how they impact particularly Black and Indigenous communities when it comes down to trusting health institutions. Today's discussion is about providing a bit of background, but also listening to the 928 voices that have been a part of this community consultation. Consultation that you as city councilors funded and encouraged to happen. Community came together, stood up, and said, this is what we'd like to see happen. And that's why we're here today, to echo those calls for change. It's been a long time coming. It feels like this has been a long journey, but the right conversation to have. Oftentimes when it comes down to our political institutions, people feel like they want to pull back, not engage. They feel like, what's the point? We've had community members come together and say, no, something needs to change, and that change is the Board of Health. I respect the work that city councilors do day in, day out. There's also that ability to help support city councilors in that initiative at the Board of Health by providing community members to sit alongside and have really difficult conversations. Some of those conversations we've had with city councilors in the interim to be able to educate and provide background information on why this change is so desperately needed. I'm not sure how much time I have left, but I'm going to try and go through a bit of my remarks here today.
You have 3.5 minutes.
Appreciate the update. The concept of community representation on the Board of Health is not just a symbolic gesture. It is a fundamental shift towards a more inclusive and responsive approach to public health. Our community is made up of individuals with unique experiences, needs, and challenges, and their insights are invaluable when crafting policies, strategies to improve the health and well-being of our residents. At the Hamilton Anti-Racism Resource Center, we believe that by supporting people who are marginalized at high risk for being left behind and discriminated against, we can improve the overall health and well-being of our community in Hamilton. That's why we held a community consultation this summer to ask people what kind of public health structure would best support their needs. We had close to 50 community members participate, and Overwhelmingly, they called for there to be a semi-autonomous Board of Health, and that's what the report says here today. We ask you to support that call. Let us embrace this opportunity to create a Board of Health that truly reflects the richness of our community, working collaboratively to ensure the well-being of each and every resident. Together we can build a healthier Hamilton for generations to come. Thank you.
Thank you very much. Any questions today for Delegate George? I see Councillor Maureen Wilson. Go ahead.
Yeah.
Thank you, Chair. Thank you, Chair. Thank you to the delegate. I would like to go back to something that Delegate George referenced in his remarks. And I believe it was referenced in Delegate Damptey's remarks, but I don't recall if he used the word. I'd like to go back to the principle of trust in institutions, and if you would care to elaborate on two things: the role that trust plays in all medical relationships, and why trust may be lacking in the racialized community, for example, the Indigenous community, for example, when it comes to traditional medical institutions or models. Because personally, I'll show my, I think it's important, but I'd like you to elaborate. Thank you.
Through the chair, I appreciate the question. Systemic racism. There's a historical concept that Kojo Damptey talked about that has been undermining that trust, and that's systemic racism. And those pressures in our healthcare system are real. And what we hear from community is that when there is trust, when there are people who they know who are connected there at the table, there's an opportunity to broaden that discussion, have difficult conversations, and understand that their lived reality is at the table. And that's a key part of that fundamental trust. When we talk about health experiences in community, there are oftentimes these are conversations that happen amongst family, amongst friends, in mosques, and in different places in which people gather and feel trusted. This can be that place here at the Board of Health, where people feel like there's representation that understands the lived reality of community, and that's a fundamental part of what we do. I've volunteered as a patient relations advisor for Hamilton Health Sciences because of the inequities that I experienced in healthcare. It's that ability to lean in and to try and recreate spaces to include community voices. That's a part of what I think community is calling for and why I think this is so important. We run the risk of when people come to the table, provide feedback, and then are told the status quo works, that they no longer trust institutions to have their voice, that their voice is heard and validated. So I can't stress enough that this community consultation that was brought forward as a part of the review process helped verify what community had always been saying, that the data represents that inclusion process is a key part of building trust, and it helps improve health equity outcomes for community.
Thank you very much. Appreciate it. That's
Thank you,
my question.
Thank you. Thank you very much. Our next speaker on the list is Councillor Clark.
Good morning, Chair. Just a couple of questions for Mr. George. For me, one of the things that I think the Public Health Committee do well is provide advice and advocate to senior levels of government, specifically on healthcare matters within the City of Hamilton. The Board of Health, the Public Health Committee, still not used to that expression, but I'm getting there, really helps to set the stage and to assist many of our health institutions in the City of Hamilton in terms of how we present ourselves to the province. Can Mr. George comment on if he feels that the changes that are being proposed to the Board of Health, how it will impact that work that we do that's so important in terms of advocacy?
Through the chair, in so many ways, and I want to be specific here in responding to it because, when this hopefully, when this moves forward, it will mean having a conversation with the province about changing the Hamilton Act. That conversation will also help build relationships with community about advocacy at governmental levels on healthcare, on issues that matter in community. And having those people in the room validate those experiences with, whether it's through healthcare or housing or on the environment, help to be able to connect those dots in realistic ways and shorten the time from having those experts at the table with you to say, this is what is happening in real time. Here's what the experience is. Here's what we're seeing when it comes to overdoses in our community. Here's what it comes when the limited access to housing. Here's what the social determinants of health say. I think that's valuable, and I think it's key insights, and I think it helps move the conversation forward.
Thank you for that, Chair. When, and I'm using the term when because it's going to happen, there's going to be a debate and discussion on it. Do you have a position, does Mr. George, Chair, have a position with regard to the number of community members that he would recommend be appointed to the Public Health Committee?
I appreciate the question through the chair. I think the format that's laid out right now in the report models the Toronto 6, and 1. I think that selection process will be really key to be able to ensure that people feel like the system is a fair way of being called into the table, an interview process, the ability to sit down with counselors across the board, across the table and say, here's our expertise, background, and knowledge, and what our experiences provide. I think that model can be co-designed, but it's really well laid out in the report. I think they've taken that time. And I think looking at Ottawa and Toronto and maybe, improving upon that can help, but I think the report provides that roadmap.
A supplemental, if I may. The selection process, Mr. George mentions that, Chair, the selection process, I think the selection process that we undertook for the Police Services Board this term, in my mind, was successful. It elongated the process, but that process was vitally important. Do you see a selection process for the Public Health Committee similar to what was conducted for the Police Services Board, where community members are a part of the selection committee that then receives the applications, interviews the candidates, and makes recommendations to council?
Yeah, through the chair to the councillor, I think it's a great roadmap. When individuals sit down in the room and have those conversations, it can help lead to better outcomes for community. I believe that's happening now at the Police Service Board. Thank you for referencing that. HARC has been a part of that, laying out that roadmap. And I think the feedback from community so far is that process is working, and I think there's trust in that system. I think it's one example that we should strongly consider.
Thank you. And Chair, just a comment, if I may, to Mr. George. I do want to indicate I have been so pleased with your performance in your role of HARC. It took us a long time to get HARC, but your role and what your leadership is really demonstrating, at least to me, and I think the broader community, what HARC is supposed to be. So thank you for all of the work and your team for all of the work and the volunteers. I see only good things in the future from the advice that we received from HARC. So thank you very much.
Appreciate it.
Thank you, Chair.
Thank you.
Thanks very much. That ends our list of questions. And thank you for your delegation. And we will continue with our meeting. You can return to your seat. Thanks so much.
Thank you, everyone.
And before we receive the delegations, I'm just going to pause here in case there are any questions for our staff with respect to the comments delegates made, or are there any comments people want to make? I see Councillor Clark.
Forgive me, Chair, but if I could just have Dr. Richardson or any of the bench explain where we are in this process, what needs to happen next, what decision points happen next for this committee with recommendations to council.
If it's okay, we're going to get to that, I know, quite soon, momentarily. So if it's okay if we leave it then, I think Dr. Richardson will be prepared to introduce that when the report
I'll
hits
leave
the
it with
floor.
you, Chair. Thank you very much.
Thanks so much. Any other questions for staff with respect to specifically what delegates said or any comments? Not seeing any, so we'll need a mover and a seconder to receive the delegations and refer them to the consideration of item 8.1. I see Councillor Taddison and Councillor Alex Wilson. Any further discussion on receiving the delegations? I'm not seeing any, so we will go to the vote. And that vote is up. And that's carried 8-0. We're now moving on to consent items, and they're both to be received, and we'll receive them together at the end, once we go through both of them. First is, I need a mover and seconder to put the consent items 9.1 and 9.2 on the floor. See Councillor Alex Wilson, and seconder, looking for a hand. Councillor Maureen Wilson. I tell you, it's like pulling teeth today, everybody. So mover and seconder to put the consent items on the floor. Thank you very much. Now we'll go to 9.1, the 2023 Board of Health self-evaluation results. Are there any questions on this item? I see Councillor Maureen Wilson. I'll add myself to the list as well. Go ahead.
Thank you, Chair. Beg your pardon. Just trying to get it open. If my memory is serving me correctly, Chair, I am wondering if the appropriate staff person could provide me a little bit of insight into a specific comment that was made in this evaluation, which on its surface I found somewhat troubling. If I have the right report, and it seemed to suggest that in the surveying of health, Board of Health members, there was some suggestion that perhaps race, even gender, if you were an Indigenous person, there was some hint that these sorts of determinants were not determinants in terms of health outcomes. But I may be wrong in that recollection, and I'm looking for some assistance in whether that was found during the consultation. Thank you.
Thanks. I'll turn to the bench. Dr. Richardson.
Thanks, Chair. I'll ask if you can turn to Peter McLeod, who is from Mass LBP and was the consultant who helped us both with the governance survey work in general, but also with this particular conversation with councillors that happened as part of the Board of Health self-evaluation.
Thanks very much, Dr. Richardson, and through the chair, I obviously undertook these conversations with yourself and your colleagues in confidence. All I can say is that to the best of our ability, we reflected the intentions of the conversations that were conducted, and I would stand by the contents of the report as documented.
Yes, thank you. I do apologize, as I was obviously not clear in my question, and I do apologize for that. It wasn't, I was not challenging the veracity of the methodology or its implementation. I was wondering if you could verify whether in your work you received some feedback that may have suggested that the uncertainty whether equity played or does not play an impact in affecting health outcomes.
I think it would be fair to say that there is a range of opinion on the question of whether systemic oppression, racial prejudice impacts the experiences of Hamilton residents and is properly taken up by the Board of Health.
Sorry not to interrupt, but I think I might be able to help a little bit here. If I have it right, Councillor Maureen Wilson, you may be referring to page 11 of 31. There's a paragraph, I would say, I don't know, 3/4 down the page.
Thank you.
A minority of participants disagreed with the need to enhance diversity and suggested that councillors are best equipped to speak for and understand the needs of the communities they're elected to represent. Is that what you were referring to?
That may have been it, Chair. I did read it a few days ago, or perhaps when we were first at this at the Governance Committee, and I just wanted an opportunity for Dr. Richardson or the consultant to help me better understand that, because as my understanding is that equity is at the core of public health, and a better understanding of what affects that could support our efforts in achieving better health outcomes. So I'm just trying to get a better idea from the consultant of what those statements perhaps meant in their work.
And apologies, I was in the wrong report when I just made that paragraph reading. That was a different report altogether. I've done a fantastic job of interviewing to cause more confusion, so apologies. Carry on.
So, sorry, that was the intent of me seeking greater clarity, because I think it's a very fundamental finding, and I'm just looking for clarity whether I interpreted that feedback correctly.
To you through the chair, I believe you did interpret that correctly, and I believe that the statement that you're referring to occurs on the end of the first paragraph of the second page, where it says, of note, some members expressed skepticism regarding claims that structural inequities in the community necessarily lead to unfair health outcomes. And I think skepticism is an appropriate characterization of what I heard.
Okay, thank you. Chair, thank you very much for guiding me on where that was. I could not find it, but I was pretty sure I read it. I guess, Chair, if this is the appropriate time or not, to ask Dr. Richardson to comment from a professional standpoint on the epidemiological evidence, which documents the role of equity, the role of race, the role of indigeneity on health outcomes. And if there is skepticism, that's a lesson, I think, for us as an existing board and a future board, that those conversations may need to be had.
Dr. Richardson?
Through you, Chair. I'm fortunate to have a couple of other experts behind me, and I can turn to them as well to ask, to address the question. But I think, what we're looking for here today is just clarity about the role of inequities and structural racism as one of those inequities in terms of its impact on health. And that role is clear. I don't think there's really any question about that. And indeed, what we've seen over the course of my career, the social determinants of health and the impacts of things like structural racism aren't new, the knowledge about those. And in fact, the knowledge about the impacts of poverty and oppression and all those things go back not only centuries, but millennia in terms of understanding their impact. But what we have seen over the course of my career is a real shift in the way that bodies recognize them. And so when we're talking about the social determinants of health, really understanding that it's not healthcare that mostly impacts people's health. It is these sorts of issues, the social determinants of health, structural racism, those issues that most impact people's health. And we've seen greater and greater recognition of that and attention to that and means to mitigate and address the concerns such as those.
Thank you. Excuse me. Thank you very much, Dr. Richardson, for putting those factual statements out on the public record. And I guess a comment from me is that there is always going to be work to be done in ensuring that we overcome whatever the roots of skepticism are by leaning into the evidence, modifying or addressing those perhaps roots of skepticism in our approach to governing, in our approach to information gathering and sharing, and in this case, looking at the institutions themselves. Thank you.
Thanks for your questions. I'm going to take myself off the list. My question was about something else, it turns out. On that note, we'll move on, if there are no more questions and comments on this, to 9.2. 9.2 on our agenda is the Governance Review Subcommittee report from November 17th, 2023. And Councillor Huang will move it. We're not there quite where we're going to receive them at the end. Oh, it's okay. Hey, I've referred to the wrong report, so I'm the biggest error maker today, Councillor Huang, so you can make as many as you'd like. On that, not seeing any, we'll go to receiving consent items 9.1 and 9.2, and we already have a mover for that. The vote will be appearing shortly. It has appeared. Okay, one moment. Sorry, Councillor Clark, yeah. Okay, it's not about the vote. The vote did carry, and now we're over to Councillor Clark on another item.
I'm a little bit confused in terms of where we are in the agenda. Are we having the staff presentation on options?
Yeah, so unfortunately what we did was we moved things around a little bit because some items were in the wrong sections of the report. So what we initially, when it was first published to the agenda, there was some issue. Who knows what it was? I'm getting a shaking no from the clerk. Long story short, we're at the consent items. We're going to go back to the other items. So yes, to answer your question.
I just thought it was the shortest presentation I've ever seen. I missed it completely.
Not to worry, we're going to be going there immediately.
Through the chair, I can just shed a little bit of light on why we shifted those items. So item 9.1 in particular, the Board of Health self-evaluation results really speaks to the decisions in the options presentation, options for governance. So we thought it was important that you considered that report before going to the presentation and approving the recommendations for the governance model.
Thanks, and now we're on to staff presentations, and I see Dr. Richardson is waiting in the wings, so please come forward at the presentation whenever you're ready. Then we'll have a discussion on the presentation. We'll get to the report after that. And for those following along, we're at item 8.1 right now.
Thanks very much, Sal. And thank you, Chair. It's a pleasure to be here today. I do not sound like myself, I know. I can assure you I am all past my infectious period. This is just that hang-on stuff that happens afterwards, so no mask. But I will probably take some pauses to cough, take throat lozenges and the like, so if you'll excuse me for those. I'm pleased to be here to share the results of the work that you sent us away to do and looking at options for the Board of Health governance structure. I'm going to give you a little bit of context around how we arrived here today as we go through this, and then go on to talk a little bit more about the consultation methods, which you've already heard a bit about, the timelines, the participants, and then the findings ultimately from the consultation. You've now met Peter McLeod, who is from Mass LBP. Just to remind you, this is the consultant that was asked to be hired to do this work, and he did do, we rolled the self-evaluation and this piece together. I thought that was the most efficient way to do it. And so he did both that evaluation conversation directly with councillors themselves, but also the broader consultation, which you'll hear described in just a few minutes. I do want to recognize as well, we have Jen Vickers-Manson, our Chief Nursing Officer and Head of Healthy Families, Ashley Vanderlaan, and both Nancy Sullivan and Rachel Harris, who also worked with us on these pieces. And much of what you'll hear through here is actually Rachel's voice. She's excellent at putting together presentations and reports. I do want to draw your attention to, you don't see her up here at the moment, but Lisa Shields from Legal Services, City Solicitor, is here with us as well online if we need to ask any questions to her or direct any questions to her. I thought I was getting to the point adequately Councillor Clark had mentioned about, so what are the next steps? Well, first, here's in brief, we wanted to give you essentially the findings right up front. And so there is substantial and widespread support to change the City of Hamilton's Board of Health structure to a semi-autonomous governance model consisting of 6 council members, 6 community representatives with health expertise and lived experience, and to have an education representative as part of that committee. I will come to next steps at the end, Councillor Clark. So just in terms of the context, reminding us all that we function as a Board of Health under the Health Protection and Promotion Act, and that act gives the role to the City of Hamilton Act in order for Council to be the Board of Health for the area of the City of Hamilton. Under that act, there are actually many different governance structures, 4 in total, that exist within all of Ontario. And most of Ontario's boards of health are actually autonomous bodies, where the membership includes both municipal members as well as they're usually provincial appointees that are at the table and come from the local community. There are also 6 regional boards of health. So you think about Durham, Peel, our neighbors in Halton, Niagara, and that's where the regional council acts as the Board of Health. For the first one, I forgot to say, the organization is usually completely separate. It's its own entity, and the staff are completely separate administratively. In the regions, the staff is part of the regional body. There are 2 single-tier boards of health in Ontario, Hamilton's being one of them. The other are colleagues next door in Haldimand, Norfolk. There's this rather a complicated example which comes out of the last round of amalgamations, and I won't go further into detail, but their staff too is part of their administrative structure. And then there are 2 semi-autonomous boards of health. So the 2 that you've already heard about and you've heard about in discussions that we've had over the last year or so, Toronto's and Ottawa's. In both those cases, the acts that lay out those cities are then they're then given the responsibility to decide on the composition of their boards of health. And they had decided to go with a semi-autonomous structure. In both of those instances, the staff remain part of the administration of those cities, and the city essentially provides the staff to those boards to get the work done. As well, the reason why they're called semi-autonomous and not the same as the other 24 is the cities decided to retain some key decisions for themselves. So in those cases, budget and the appointment of their medical officer of health are the primary issues that they decided to retain responsibility for, but all other decisions are left to the semi-autonomous board. So all the policy, program decisions, all of those things. So I just wanted to go back over that in terms of the context. Here in Hamilton, since 2006, which is a time period, of course, for those of us in public health, is known as the post-SARS period. The public health governance here in Hamilton has followed a 2-step process. So we've had a public health standing committee, which at times was called the Board of Health Standing Committee, but it essentially has met monthly to discuss public health programs and services. It has been made up of all of council since 2006. And recommendations from those meetings are submitted to City Council, who, acting in their role as Board of Health, which is their responsibility under the current situation, decides whether or not to approve those recommendations. Part of this was developed to address what was called the 2-hat dilemma, which came out of some work post-SARS, and particularly after some governance failures that had happened at some health units, and where it was recognized that councillors have a difficult job in that they have to do their due diligence under the Health Protection and Promotion Act in doing what's best from a public health standpoint, but they also have a role to play as a councillor in terms of financial issues and those sorts of things and their due diligence from that perspective. And so that was part of the reason why it was set up in that way, so they could think of the public health issues as a whole, and then they could think of things more holistically at the next level. So we know that beginning in March of 2021, we've had several delegations, and you've heard from a couple of those people already this morning in relation to this issue again. And essentially, those delegates wanted to see community representatives with health expertise and lived experience at the table when making public health decisions. They particularly focused on that semi-autonomous governance model that Toronto has and Ottawa has, and thought it was particularly a good time to be looking at these governance issues, given the very clear impacts that COVID had in terms of disproportionately affecting our most marginalized communities. So building from that, there was a governance education session that Karima Kanani, who's a partner at Miller Law, came and presented to you all and gave you further background about the legal issues, the equity issues. We were fortunate she had expertise in both, and in fact had been an expert who had taken, had done the work in a couple of amalgamations that had happened in public health. A very rare thing to have somebody with such expertise talk about those issues. And so we were directed after that to go out and do this consultation with advisory committees, community partners, healthcare professionals, members of the public, other interested stakeholders around public health governance. So we focused on the issues and opportunities with the current governance structure, as we were directed to do, and looked at alternative governance options. And of course, there was an amending motion that also laid out a specific composition as well as a nomination process, which has already been referred to this morning, for the Public Health Standing Committee. And so those things went forward to engage with all of those groups. I'll go into the methods a little bit more in a moment. And we did hire Mass LBP, which is an independent public policy firm, to do this, this consultation. Methods-wise, we did a public survey, which was posted to our Engage Hamilton website. It was promoted to residents through social media, digital advertisements, and we know that councillors as well were promoting it through their newsletters and things that would go out with to their communities. We were fortunate in a way that the homelessness issues were happening at the same time, which we know drew a lot of people to the website. So we got a lot of views on the website because of the number of people that were coming to the Engage Hamilton website. There were also key informant interviews that were done and meetings with advisory committees, community partners, healthcare professionals, and city council members. And so Peter and his colleague did all of those interviews and members. I think there was 928 respondents on the public survey and over 60 key informant interviews. And then the Hamilton Anti-Racism Resource Centre and the Hamilton Centre for Civic Inclusion told us that they would like to hold a community meeting and hear further from people through that meeting. And we were fortunate that they invited us to come and be a part of that meeting so that we could hear the issues for ourselves, which was very helpful. And so that was another source of input, which was taken into account in putting together the reports. So as I said, 928 survey responses, 63 key informant interviews, and there were about 50 attendees at that community-led meeting. This is the full list of all of those who were consulted, the committees, the individuals, and the organizations that were consulted. For advisory committees, it was a bit of a tricky time because it was summertime and those committees don't usually meet. And so if there was a meeting, we managed to get on the agenda and talk to people. If there was not a meeting and an inability to put one together with quorum, we went and spoke to those that were, not we, Peter, went and his colleague went and spoke to those individuals who were available at that time. There's a number of both health system partners on this list, the GHHN. We had the partners the hospital and healthcare partners who had helped through the COVID response. And as well, we looked to see if there were others with governance expertise in the community. So we asked for the Chamber of Commerce and the Hamilton Community Legal Clinic to provide some input as well. So just wanted to be clear about the options that were carried forward through the consultation. And so these had been outlined in the motions, but just again for clarity. So the first was adding an advisory committee to advise on issues directed to them by the current Public Health Standing Committee. So that would be a committee, an advisory committee that reports to the Public Health Committee. We had a model where it was community representatives and those with health expertise as well as lived experience in education again, who would be on that advisory committee. We had as a second option changing the membership of the Public Health Standing Committee to include a mix of City Council members and, again, community representatives with health expertise and lived experience, and an education representative. And then that would continue to report to Council as the Board of Health. And then finally, the third option was to change the structure and membership of the Board of Health per se, so that it is partially or fully autonomous from City Council, with a membership, again, that was a mix of City Council members and community representatives with health expertise, lived experience, and education. So what did we hear? So the majority of our consultation participants felt that option 3, that was changing the structure and membership of the Board of Health, was the most suitable option. And noting that if that was to go forward, and they were aware of this, that this transition to a semi-autonomous board would require changes to the City of Hamilton Act, so that it changed and would outline that the board would be different than council itself. And potentially, in our conversations that we've had over the last year or so with the Office of the Chief MOH, it potentially would require changes to the Health Protection and Promotion Act as well. The option was supported across all of those consultation types, not only in one. I forgot one detail about the survey piece, which was just in terms of representativeness of that survey. There had been some, we wanted to check on things as we go. Felt it was a really balanced group that we had that had engaged with that survey. There was an overrepresentation of women versus men was the only change, and a slight underrepresentation of racialized groups compared to our general population, but otherwise it was representative. So again, looking at those, all three of those different consultation methods supported that. As well as in talking with the participants, they suggested that as an interim step and something that could be done in a more timely way, that council could look at changing the membership of the Public Health Standing Committee so that that could be implemented more immediately, knowing that in our experience in talking to the other boards of health in Toronto and Ottawa, that took about 2 years to get through that process as we go forward. I think from a timing perspective and what we've heard from our colleagues at the Office of the Chief MOH, given the changes that they're looking at with the standards and those sorts of things in 2024, they are looking, this would align well with the changes they're doing. They think there might be opportunities, if there's a Health Protection Promotion Act change, that would align well with their timing on things that they're considering at the provincial level. In addition to those recommendations, the information that they brought forward, there were other ideas as well that they thought needed to be incorporated into those changed governance structures and things to strengthen governance. The first was the need for a transparent selection process for community representatives on the Standing Committee or Board of Health. They wanted to ensure that the selection committee and the selection process was based on best practices, based on demographic data to determine representation, and as well using community consultations, and that from a best practice perspective, that they had the necessary competencies, skills, understandings about anti-racism and health equity, for example, and those sorts of things as they were selected and went forward. They also proposed that there be clear training and education about public health concepts. For this council, this committee, we do that, you'll recall, through an orientation process and stage that out over a few months. So I think in what I was hearing in this piece was just with it being an entirely new group, probably a deeper training and education process would be needed, and that really looking at collaboration, partnerships, accountability, reporting was very important in terms of building trust and maintaining trust with the community more broadly. And so you've got the recommendations that are before you in the report. The first one being to approve in principle a semi-autonomous Board of Health with features similar to Toronto and Ottawa, and to direct staff to prepare and submit an application to the province for special legislation to amend the City of Hamilton Act and the Health Protection and Promotion Act if needed, to authorize the city to implement a semi-autonomous Board of Health with features similar to Toronto and Ottawa. At the same time, we would report back to you with this committee in particular, following approval of those legislative changes with a plan to implement those. So we would start to develop those plans and bring them back once those changes were established. One of the things to note is that we would, as we understand it to date, we'll get more confirmation as we work it through with the Ministry of Municipal Affairs and Housing, as well as our OCMOH colleagues, that there would need to be a member of parliament from this area, member of provincial parliament, who would make that motion in the legislature as well. That as an interim solution, until that authorization is received, that a change be made to the membership of the Public Health Standing Committee to include 6 council members, 6 community representatives, and an education representative. So similar to what would be recommended for the semi-autonomous board, and that to appoint those members, that the existing selection process be utilized as we go forward. In that selection process, we're suggesting that we consider the standards that are already out there for boards of health in terms of what to look for and what members should have in terms of competencies and skills, as well as making sure that there is input members from across the spectrum in terms of health providers, community representatives with lived experience from different areas, those sorts of things. So we would bring back to you the qualifications and criteria for selecting those that would then be utilized through the selection process. Next steps. So the next step would be to begin that application process and put that forward if these recommendations were approved today. And then for the purpose of implementing the changes to the Public Health Standing Committee, we would develop those qualifications and criteria and bring them back to the Public Health Standing Committee for approval. And then there would need to be an amendment to the procedural bylaw in order to change the terms of reference of the Public Health Standing Committee, and there would need to be an amendment to the corporate policy around the appointment of citizens to the local boards as well. So that wraps up the presentation, and if there's questions, I'd be happy to take them. And of course, we have Peter as well, who we can direct questions to, and of course, Rachel in particular is here if there's some details we'd like to ask.
Thanks very much. If it's okay, I imagine there may be some questions or there may be a somewhat lengthy discussion. If it's all right, could we receive the delegation, so receive the presentation from Dr. Richardson and then go to the report and then just really have the discussion there? Is that okay? It's really similar. Okay, great. So yes, thank you. We'll receive the delegation. I have a mover and a seconder to do so. So Councillor Tattison and Councillor Alex Wilson. Discussion on that? Not seeing it. All those in favor or opposed? We shall have an electronic vote. And that electronic vote is present on your screens. And that carries 8-0. And so we'll go to the report itself at this time. I'll need a mover and a seconder to put the report recommendations on the floor. Moved by Councillor Huang, seconded by Councillor Alex Wilson. And I will now take speakers for the report. Any questions or comments? We'll start with questions if it's okay, and then we'll go to comments. I primarily only have comments, so I'll wait till the end. Questions? Councillor Clark, and then Councillor Danko. Councillor Clark, take it away.
Thank you, Chair. I'd like to ask, were there amendments to the Health Protection and Promotion Act reflecting the changes that occurred in Ottawa and Toronto to a semi-autonomous board?
Through you, Chair. I don't know the answer to that question. We've asked in terms of what happened, but the people who were present at the time have moved on. And so they weren't able to answer those questions. We've asked the Office of the Chief MOH, and said, it looked like it was just the City of Hamilton Act, but they said, we just need to be sure. And so they would go through that process once the application was received to have that discussion with the Ministry of Municipal Affairs and Housing, as well as with their legal entities, to look at whether there was anything needed. So that's why we continue to say we know that there's changes needed to the City of Hamilton Act, but that the final decision around that will come through the discussions with the province.
So we do need to change the City of Hamilton Act, which is a private act that usually occurs in the last few sessions prior to them shutting down for Christmas and for their summer vacations. So do we have an indication as to timelines with respect to changing the private act? And do we have an indication in terms of a government member in Hamilton who is willing to move the motion for the amendments to the City of Hamilton Act?
Through the chair. So we don't know the timeline, and I think nobody wants to guess those things, all the people that we have spoken to at the provincial level, but in discussing with Toronto and Ottawa and noting their timeline, it tended to take about 2 years to make the transition from in terms of the semi-autonomous board. It took about 2 years to make that transition in its entirety.
I see.
I don't know from the provincial standpoint. The second question that you asked, if you can remind me, Councillor?
I believe it was with respect to have we reached out to a government MP or government member in Hamilton who would be willing to move the motion to amend the City of Hamilton Act, because I believe that's the requirement.
Through the chair, at this point, I don't believe that anybody has been reached out to. There's been discussion about it, but not that a particular person has been engaged.
Thank you. May I ask, Chair, with respect to Ottawa and Toronto, after they made the changes to a semi-autonomous board, what has been the impression of how that governance body has worked in those two municipalities? Have you heard of any issues or challenges?
Through the chair, so Toronto's transition happened at the time of amalgamation, and so that Toronto was amalgamated. So that is, a fairly long time ago. And of course, they were bringing together 6 boards of health that had been the former municipalities into a single one. That said, not heard of any issues in terms of the functioning of the board or any of those sorts of things. I would say similarly with Ottawa, I did have some discussions with the former MOH back at the time that he was there post-transition. Again, no challenges in terms of changes. And similarly with talking to the current MOH, no particular issues. They would be functioning well. And everybody has had their challenges over the last 3 years in terms of dealing with COVID and whatnot, but none of those have been a governance issue.
Thank you for that. Chair Kretsch, may I ask, with respect to the semi-autonomous board where budget and the hiring of the medical officer of health remains with the council, I'm a little bit confused. So if it's a semi-autonomous board, is that suggesting that those boards make all decisions with regards to public health and that they are not ratified at council, and the only things that council would have sole autonomy on would be the hiring of a medical officer of health and the approval of the budget?
Through the chair, that's correct. And so that's the meaning behind the semi-autonomous, is there is a very limited a few decisions that are reserved to be the purview of their council, and the rest of the policy and program decisions are made by the board itself.
And so then the decisions of those semi-autonomous boards, they would be implemented through public health staff right from any policy decision of the semi-autonomous board?
Through you, Chair, that's correct.
Thank you for that. May I ask, with regards to the semi-autonomous boards hiring the medical officer of health, is it possible, if we go down this road, that this semi-autonomous board, that there would be members that would be involved in that selection committee with the City of Hamilton, much like we did with the Police Services Board?
Through you, Chair, I think I'm not quite clear on the question, Councillor.
So what I heard today was the hiring of the MOH and the budget are solely the purview of the council in Ottawa and the council in Toronto. If we look to the hiring of the MOH only, is it possible to ensure that members of the semi-autonomous Board of Health are a part of the selection committee that hires the MOH? Or would that be a decision of council in terms of setting it in their policy if they choose to go down that road?
Through you, through the Chair, I do agree with what you just said, Councillor, that essentially, since that decision would be reserved to council, then it would be up to council to decide on the process for hiring.
Thank you.
We're just running out of time, Councillor Clark, so if this is your last question, that's okay. Otherwise, if you don't mind going on a second time, there's
I'm
a
happy to
speaker's
go
list.
on for a second time. I think I only have one or two more questions, but
Okay, go for it.
I don't
By all
want
means.
to. I would prefer just to put me on second time. I don't like stepping on toes.
There are only two other speakers on the list right now, so you might as well, if you've got one or two, just go for it. I just wanted to check in, so thanks. Go for it.
Thank you very much, Chair. I appreciate that. So we've been provided options. Of the options, am I to infer that you, Dr. Richardson, as our medical officer of health, that your recommending a specific governance option, which is the semi-autonomous?
Through the Chair, yes, we're providing you with specific recommendations rather than options to choose from. The options are the options that were outlined during the consultation process. And so the recommendation is based on the discussions that were held across that consultation process and in consideration of conversations with legal and clerks here, the former clerk, Andrea, as well as looking at the Ontario Public Health Standards and what they outline around what the best practices in governance are, as well as the education session provided by Karima Kanani. And so based on all of those, that collection of information, have come forward with the recommendations around approving in principle a semi-autonomous governance structure to go forward and submit an application to the province, as well in the interim to look at changing the membership of the Public Health Committee to be a mixed membership committee that would report to the council, that would remain as the Board of Health until such time that the legislation is changed.
And thank you. I didn't mean to put the good doctor on the spot, but I have come to rely on her advice, and so I simply wanted to hear it from Dr. Richardson. Thank you very much.
Thanks, Councillor Clark. And next on the list is Councillor Danko, then Councillor Huang. Oh, Councillor Danko has pointed to Councillor Huang, which means now Councillor Huang is next on the list. Councillor Huang.
Thank you. I have a couple of, I guess, in the weeds kind of questions. Should we move for, we are making a decision as to the one recommendation, which is, as Dr. Richardson has already aptly laid out for us. I'm wondering, what is the decision-making opportunity around the semi-autonomous, and will they have access to a budget, or does budget then get transferred? I want to understand where money goes. So I really want to understand how does, like, what does the money situation look like here?
Through the chair, so the specifics of the process would have to be worked out, and I'm turning to Mike, but the specifics of the process would have to be worked out. But essentially, what would happen is there's the annual service plan and budget, which is approved by the Board of Health, which our Public Health Standing Committee will see in February. And so that overall budget portion of it would have to mesh with the city's budget process, just as we do right now, and have the city make the determination about the total budget that would be provided to the board. That's how it works in Toronto and Ottawa. We'd have to sort out Hamilton's version of that. And then once that is determined and that envelope given, that is then overseen by the semi-autonomous board. If there is a need for further dollars or anything like that, one would see that would have to come back to council, because it would continue to be a budget issue in terms of how it would move forward. But I don't know if Mike wants to make any other comments. I know he hasn't delved into this as of yet, but just if he has other comments.
Through the chair, Mike Zagier, General Manager, Finance Corporate Services. No, I would just simply add, with respect to external boards and agencies, we've had a practice whereby council has provided in some years guidelines to semi-autonomous boards and agencies. Those agencies take the work of developing a budget away, present it to their boards. The boards then would have to make a decision either to approve or to amend. That ultimately then is presented to City Council for deliberation and consideration and ultimately approval, or referral back to the board for further consideration with some intended directions. So just drawing from our past experience with boards and agencies.
So Chair, just a tiny bit more clarification then. Would we be treating the semi-autonomous Board of Health similar to how we treat the police board, for example, where the police board determines the budget and then it ultimately comes up to council for just approval? Or will council have an opportunity to actually take a line by line look? Because at this point, we actually don't have any ability to influence anything on the police board's budget, because all we have to do is say yay or nay. So I would like to understand, where would council's sort of decision-making stepping in kind of come if we were to go into this type of a process?
Through the chair, one of the differences may be with respect to police services versus a semi-autonomous Board of Health is council's role as it relates to police services budgets is defined or described in the Police Services Act. So there is legislation that speaks to the role of the board and speaks to the role of municipal councils. So again, without having delved into this particular item, it may be subject to the roles and responsibilities of the board and how those are defined, and then the role and responsibility of council as it relates to the services or programs and the service levels or programs that that the budget supports or proposes to support.
So then, Chair, I think I'm trying to understand the role of preparing an application to the province for special legislation to amend the City of Hamilton Act, because just as we heard from GM Zagarek, that it is already governed by the Police Services Act, that we don't have any insight into that budget process. Is there an opportunity to look at it from a legislation perspective where it does give council an opportunity to be a little more prescriptive when it comes to directing some of the overarching large sort of impacts that will ultimately come down to the taxpayer, and giving council the authority to augment the budget? So I think I want to understand the legislation aspect of this. Through you, Chair.
And if you could clarify in the context of asking this question, operationally, what the Board of Health does with respect to public health staff versus operationally, the difference between that and the police board, which obviously, of course, has a whole Hamilton Police Service underneath it, has a Police Services Act. I get your question. I think I have the answer, but Dr. Richardson, take it away.
Through you, Chair, I don't know the details of the Police Service Board to be, and how it's applied to be able to answer how they compare. So I can only tell you how this functions in terms of Toronto and Ottawa and how they go forward. And so what's I think critical here is the term semi-autonomous as opposed to autonomous. So in an autonomous health unit, the health unit actually has the ability to inform, once the decision is made by those collective municipal members and provincial appointees, they have the ability to inform the council of what the budget requirements are that they need to receive from those municipalities. So that makes it totally autonomous. In a semi-autonomous model that Toronto and Ottawa have, they keep that budget final decision-making role with council. And so my understanding from talking to my colleagues in Ottawa and Toronto is it's not dissimilar to how it is now in terms of their ability to look at the budget, ask questions about the budget, modify the budget. And so that's been a key part that they have wanted to keep as they go forward. Chair, was there another question in terms of
No,
that?
you answered the question. Thank you so much.
Yes, you answered the question. Thank you. My last question then through you, Chair, is in terms of timing. Given that how we've laid this out or how Dr. Richardson has laid this out, what is the estimated time? And I think I know the answer, but I do wish to have it be kind of publicly stated. What is the time to potentially get an application to the province, to have them look at the legislation, have them amend this? Where do we go from today to a final state, and what does that estimated time frame look like?
Through the chair, so the changes to the Public Health Standing Committee itself could be shorter, and I turn to clerks, I would say in the 6 months range. Am I, is this a good guess, Janet?
Yes, through the chair, that would be correct.
In terms of changing the structure of the Board of Health, that would require that application process that you've just outlined in all those pieces. We don't have an estimate. I think as Councillor Clark alluded to earlier, it depends on the timing of things in the legislature, you know, those various components of it. They've certainly done this before. It's not the first time, so it's going to be somewhat smoother in that regard. But what we've heard from our colleagues elsewhere is it's taken 2 years to get fully through the process. I have my fingers crossed that because it's done it before, you know, they're aware of these issues, and the fact that they're already anticipating making some changes through the 2024 process around the standards for public health, that this might align a little bit better with it, but I would take the experience probably over that hopeful estimate.
Thank you. Thank you. Those are all my questions.
And for questions now, we're on to Councillor Dankel, and then I see Councillor Clark for a second time.
Thank you, Chair, and appreciate joining you today at AFNA. Following the excellent questions by Councillor Wang on perhaps some of the unintended governance issues, so I think if we had just before us the recommendation on the semi-autonomous Board of Health, it would probably be a universal, unanimous approval. I'm going to focus in on B, which is basically a recommendation that we create a new Board of Health advisory committee with citizen members, and then we make that advisory committee the authority of a standing committee, and then the work that would otherwise happen at the standing committee is going to now happen at council. So my question, just first on from a governance perspective, if the consultants that made this recommendation, what their understanding is of the purpose of a standing committee.
Question is about the purpose of a standing committee. That's to you, Peter.
I'm going to refer the question to Dr. Richardson. The report that we've provided conveys to members of council what we heard, and my understanding as to how the interim measure might function differs from the councillors, but there's greater expertise with Dr. Richardson and her colleagues on this matter.
So taking that referral, if I could, Chair, from Peter, I'm going to use some language, and it's been confusing over the course of the debates in this issue. And we've cleared a lot of that up by renaming the Public Health the board, what was called the Board of Health Standing Committee, to the Public Health Standing Committee. And so just in terms of the options and what's recommended in B, just to be really clear, the Board of Health is the final decision-making body today that rests with Council. And in the recommendation going forward, the policy decisions would rest with the semi-autonomous board, and the finance and staff appointment would rest with Council. What recommendation B does is say, in place, we would continue to have in the interim until such time as went forward with the semi-autonomous board, that the membership of the existing Public Health Standing Committee would shift. I'm very, and I don't think this was intended, but I'm just trying to be very clear with language. I'm not using the term advisory committee. We're not recommending that there be an advisory committee set up at this point in time. We think that adds too many layers to discussions and decision-making, and it's better done by bringing those voices together at the Public Health Standing Committee, which considers issues, has the debates, discussions, benefits from both the staff work, but also the members around the table, and then makes those recommendations in the interim to Council, which continues as the Board of Health until the semi-autonomous group is put in. So I just wanted to be clear with my language around that. And so with that, Councillor Danko, if there was something that I missed in that, I'd be happy to speak further.
So yes, perhaps I'll give what I think the purpose of a standing committee is, and then staff or whomever could comment on how this structure fits into what's being recommended. So we are in a standing committee format today. The purpose of the standing committee governance structure is to provide a place where there is debate and discussion on reports before they are referred to Council as the ratifying body for a final decision. Council, or in this case, the Board of Health as Council, is not there to have an in-depth debate discussion on reports. There's no delegations. Council as a ratifying body's purpose is to basically, to use an analogy, it's the Senate. It's the sober second thought. That's where the decision is final. So the purpose of a standing committee is to provide a democratic forum for debate and discussion on issues that are before this governance structure. So effectively, what is being recommended is an advisory committee, but it's being given the authority of a standing committee, which then just bumps up that debate and discussion that would otherwise happen at the standing committee level to the Council level.
I think the question is that the right understanding, or could you clarify that? I think that's the question.
And through you, Chair, I'm just looking to Janet as well. I don't know if she wants to start, and perhaps I could add any other comments.
Through the chair, a standing committee, as defined in the procedural bylaw, is composed entirely of members of Council. So that would be one amendment that we would have to make if this was put into place. But it would be, I wasn't part of the discussion on these recommendations, so if the Public Health Committee now reports up to the Board of Health, at Council, we would have to revert into Board of Health? Okay, so, sorry.
Just to clarify before we turn to Dr. Richardson, the only reason that the acting city clerk wasn't part of the discussions is because she's the acting city clerk. The previous city clerk was part of those discussions and is no longer with the city of Hamilton. Just so we're clear. Dr. Richardson?
Yes, thank you, Chair. Yes, and sorry, Janet, it puts you in an awkward position. So I think in terms of the function of the standing committee, as has been outlined, to have discussion, have debate, do those things, I think it is up to council and in its relationship with that standing committee, how it wants to have those conversations and whether it feels it needs to as a whole, as the Board of Health, have a more fulsome debate at that level. I think that's really more a decision about how it moves forward than a structural or policy decision that could be defined by staff. And I'm just looking to Janet to see if she agrees with that.
Through the chair, I do agree with that.
Okay, Councillor Danko, does that answer your question? I'm only asking because if,
Somewhat, but I'll move on.
okay.
Second question is the recommendation, again, focusing on B, the standing committee. The recommendation is to have 6 members of council, 6 community representatives, and 1 educational representative, which effectively gives the councillors on that committee a 2-vote minority. So why was that composition specifically chosen to provide that would have a structural minority position for council on our own Board of Health Standing Committee by 2 votes?
I think you may have addressed this in your presentation, but yeah, if you don't mind answering, I think it's based on the other model.
Through the chair, yes, it was not an easy decision as to what to put forward in that context. And, I think there are considerations that this committee should think about in terms of just what you've outlined, Councillor. The Health Protection and Promotion Act itself, when it comes to autonomous boards of health, does ensure that there is one more municipal member than there is public or provincially appointed members. There's been at least 1 Board of Health in Toronto that's chosen not to go down that route and has an equal member and a member from education. And one thing I didn't say when Councillor Clark asked the question about functioning is my understanding is it has been difficult for Toronto to consistently have an education member at the table, which has meant that eventually it functions as an equal number of representatives a lot of the time. That said, they managed to go forward and address issues and don't have any issues with moving forward. And so I think this also is where we looked at, how is there balance created in discussions, as we said, internally as well with the former clerk and with legal services, and recommended the existing selection process for those members, because that would, again, leave it up to council to decide on who the members ultimately were of the committee. So we were trying to find a middle ground, knowing that that the input from the consultation was the Toronto model, essentially, was spoken to favorably in terms of the model to pursue, which does have that unequal representation, but leaving the selection process itself in council's hands in terms of moving forward and ensuring transparency and all those other things that are criteria through that selection process. But it is one of the most significant items, I would say, for this committee to consider in terms of how it moves forward.
Just before you go, Councillor Danko, just making sure I understand that you said earlier in your presentation today that specific selection process would be coming back after the approval today for a vote by this committee.
It's actually the criteria that would come back.
The criteria would come back. Thank you. I just want to make sure we all understand exactly what the little process is, right? So we're doing one thing today. The criteria will come back for the next committee, future date. Councillor Danko?
Thank you, and I appreciate the answer. I'm not a member of the AFNA committee, but I would ask committee members to seriously consider an amendment to revise the committee structure to have 1 more council member than other members, as is the standard practice for the autonomous boards of health. The reasons for that should be obvious, that it's our own Board of Health governance structure, and we are as a council, are ultimately responsible for the decisions of that standing committee, and that would be the reason why we should hold a majority position, which would be 8 members of council, or alternatively remove a citizen member, which would at least give it a balanced vote, 7-7. Yes, 6-6. Moving on, the qualifications of committee members. So that is a report that's going to come back on specifically what the qualifications are going to be. In healthcare, in particular, professional designations are very important to ensure competency, and also, I think, to ensure that there is a level of accountability. So if someone has a professional designation, they are accountable to their professional governing body. As counselors, we're accountable to the public. So through you to staff, I guess, how will that accountability be considered when we're selecting what the qualifications of and expertise of potential citizen members?
Through you, Chair. So in terms of the criteria and qualifications, they are outlined in the report as sort of the general ones that we're suggesting for consideration, and that's on page 10 of 12. So including things such as an understanding of diversity, equity, inclusion, anti-racism, anti-oppression, health equity, having interest or skills in planning and policy development. The Ontario Public Health Standards goes on to talk to strategic planning, finance, all of those things. And so there were other issues that were also outlined in one of the motions that spoke about, being a member or working in City of Hamilton, or it's like being a resident in or working in City of Hamilton, and other considerations that were in that as well. And so when we speak to the criteria and qualifications, we're speaking really to that level of criteria and qualifications. We would not see entering into that, the need to have for example, when it came to somebody who has an understanding from a health perspective as being part of that, we would not see putting in, specific qualifications from the Regulated Health Professions Act for medicine or nursing or any of those sorts of pieces, but rather that they come from a health background. Ultimately, it would be up to the selection committee itself to go through the process and look at amongst those who applied and knowing, the kinds of skills and competencies that are being sought under those criteria, making a decision who are the most appropriate mix of those skills and individuals to come forward and be part of that standing committee.
Thanks, and you're right near the end of your time, Councillor Danko, so if you've got another question, go for it, and then I'll turn to Councillor Clark and I come back to you, because there's other speakers emerging on the list here.
Yeah, if you could put me on for a second time, and I'll just finish my thought on the answer that we just heard, if that's okay. So I think this is a report back, so I don't think we're having that discussion today on the specific qualifications, but again, that's I think should be a big red flag that if they're going to people that are not regulated health professionals, they're not accountable in any way. And we saw during COVID, people without legitimate health credentials giving public health advice that is problematic, to say the least. Thank you.
Thanks. So add Councillor Danko on for a second time for questions, or if you want comments, up to you. Right now, I'm just going to give people a sense of where the speakers list is at. We have second time speakers for questions, Councillor Clark and Councillor Huang, and then we have comments, myself and Councillor Alex Wilson. Otherwise, Councillor Danko is on in between those until I know exactly which place he wants to be. Is it questions or comments?
Question.
Okay, questions. So you'll be after Councillor Huang. Councillor Huang. Councillor Clark.
Thank you, Chair, and you're doing an excellent job this morning. I appreciate it. My first question is one more of clarification. So as we have noted this morning, the Police Services Act is rather prescriptive and says that the Police Services Board makes the determination on the budget with the police chief's advice to the Police Services Board. When it comes before council, council is restricted in terms of what they can do. They can say yes to the budget. They can say no to the recommended budget. And that's it. They can't start digging into line items and say, you know what, get rid of the horses and get rid of the armored car. We don't have that authority at council. It's the Police Services Board that deals with that. So my question, and I'm not sure to who the question will be, so I'll leave it to you, Chair. Under the Health Protection and Promotions Act, and I haven't read that in a long time, does it restrict council's funding approval in any way similar to the Police Services Act?
If it's okay, before I turn to Dr. Richardson, I'm just going to summarize, I think, various nods and eyebrows you can't see from where I am, which have been helpful. I think what the consensus is that this semi-autonomous recommendation that Dr. Richardson is making wouldn't be subject to the same kinds of provisions we see with budgets related to this Police Services Act. Council would be in control of the budget, period. That's my understanding, but I'll have Dr. Richardson confirm. I just don't want them to have to try and repeat themselves if that's already what they've said.
I appreciate what you said, and I would like to hear from Dr. Richardson.
Through you, Chair. Again, not fully being cognizant of the police legislation, but essentially when it comes to, again, that distinction between autonomous and semi-autonomous, if you were to decide instead of going the semi-autonomous route to go the autonomous route, then those decisions would be made by the board exclusively, and then the decisions would be communicated to the councils. In the semi-autonomous model, you decided to reserve some decisions, and we're suggesting that the financial one would be one of those. And then that decision around budget would be the purview of council. And so I don't see how, and I'll turn to Mike again, if that is the decision of council, then making any inquiries as to that budget would be a part of that role in decision making.
Through the chair. I would agree with Dr. Richardson's description in terms of the roles and responsibilities of council in a semi-autonomous model. And again, financial decisions relate to service and programming, and under the semi-autonomous council then would have an authority to amend the service or programming to align to the financial capacity that that council would ultimately be approving.
Thank you. That actually does help me a great deal. It clarifies it. The next question is on a different matter. The province of Ontario twice now has indicated that they're interested in reviewing how public boards of health operate in the province of Ontario. And more specifically, they're interested in merging boards of health and public health departments together to, in essence, decrease the number. I believe after the pandemic, they reiterated that they are looking at it. Can someone tell me where the province is? And should we make this decision? My thought is it really doesn't matter what we do at the moment. If the province decides to change it, they're going to change it. But we can't wait for a provincial decision because it's been almost 3-4 years since they first talked about it.
Through the chair. So the councillor is right in that the province continues to look at ways to strengthen local public health agencies. And as you'll recall at the November meeting, we talked about that plan that they have underway, which is to look at the programs and standards that are a part of what's mandated by local boards of health in terms of what they must provide. And they are also looking at voluntary mergers of local public health agencies in order to strengthen their capacity and ability to provide services to their areas. And so just underscoring that previous discussions had been looking at a specific number of mergers or particular organizations being merged or a number of health units of outcome. That is not the approach that is being taken by the province at present. It is one of encouraging voluntary mergers to build capacity within those within health units. And of course, that's particularly from the field's perspective, looking at the smaller health units that exist in the province. We have some very small health units. And so we are not, we aren't at this point. I don't believe any of council or council as a whole has been approached by any boards looking to have a merger discussion. And so that is not something that staff have been looking at, as it's not been directed by our board to do so. So we don't anticipate that being an issue at play for us. In our discussions with the Office of the Chief Medical Officer of Health, I can, just from a timing perspective, Dr. Moore would be aware that this was the approach being taken by the province, and he told us that he didn't have any concerns, as we've outlined in the report, didn't have any concerns in terms of moving forward and in terms of how this might work in terms of their plans for the future of public health. He thought it would be fine to pursue this, and as well he thought, as I mentioned earlier, that from a timing perspective it was probably apt given the issues that they were considering over 2024.
Thank you, Chair, for that. I appreciate Dr. Richardson's response, and I'm glad they reached out to the CMO to see where they are and could we proceed. And it would indicate, based on what Dr. Richardson said, that's not an issue for us. We can proceed. The last question I have, and I would provide the preamble, it's to Mr. McDonald. I want to thank him for the work that he did with regards to the consultation. It was excellent work, and I appreciate the document. The only question that I have is, was there anything in your consultation that you heard which you found disconcerting or troubling?
I certainly appreciate the question. But through the chair, I am reluctant to insert my own subjective views of the merits or demerits of anything that may have been said during the conduct of the consultations. I think the report quite thoroughly represents the range of opinion that we heard, and I think, as you will have noticed, there was a strong belief in the importance of bringing additional voices to the governance of public health in Hamilton. And I think the recommendation before you today certainly reflects the strong balance of opinion that was reported through our various consultation processes.
Thank you, Chair. Thank you, Peter. As always, you are very professional and your report was outstanding. So I do thank you for all of that work. Thank you, Chair. Those are all of my questions.
Thank you, Councillor Huang. I just want to let committee know it's 11:15. We have the Emergency and Community Services Committee at 1:30. And I know that many people in the room would probably want to eat something before the end of the day. So just going to signal that now. I'm going to try and hurry this a little bit along to the recommendation. Then we have a number of other agenda items to get to. So I'm just flagging the time. Take it away, Councillor Huang.
Thank you, Chair. I have another in the weeds kind of question. Given that let's assume that we are moving forward exactly as recommended, the citizens that will be appointed to this new Public Health Standing Committee, because it is a decision-making and debate kind of body, will these be paid positions?
Through the chair, so when it comes to the semi-autonomous board, the Health Protection and Promotion Act requirements would apply in terms of amounts that need to be paid to the citizen members. I just quickly asked Janet whether we had an existing policy around payment for committee members, and we don't. So I would suggest that's something we should consider in the report back around criteria and qualifications.
Yes, because, Chair, I'm mindful that this is the very first time we're going to be having citizens sitting on a standing committee, because all standing committees currently are council members, which are all paid council members. So remind me again, when is the report back on all of this?
Through the chair, there isn't a specific timeline that is outlined in the report, but we would do it in as timely a manner as possible.
Okay. Okay, and then my last question then is, will the citizens sitting on the standing committee be also held to the same standard of code of conduct that council members are already being confirmed to?
Through the chair, they would be under the code of conduct for local boards. Those are the citizens.
Local boards of the citizens, but not to this, sorry, Chair, is there a difference between the levels between the local boards and what council members are being held to a standard of?
There are differences in the code of conducts. Yes. I can't speak to them specifically, but they are different.
Okay. Again, sorry, this is all just generating a significant new line of questioning then. Because citizens sitting on the standing committee will have decision-making powers, I hesitate because if they are different levels, I would like to understand, but this again might be getting into the weeds, it might be in the report back, so I will save my questions for along later in that process. Thank you.
Thanks, Councillor Huang. Councillor Danko, you had more questions?
Thank you, Chair. Just two questions on selection and nominations. So understanding the recommendation is that the selection process will use the city's existing selection processes, so that's fine. On nominations, I want to be clear that this would be an open nomination to anyone in the public that chooses to submit a request to serve on the Board of Health, whether it's semi-autonomous or the standing committee.
Through the chair, that's what's envisioned at present.
Okay, thank you. And my last question, Chair, is just, you did a comprehensive review of all the Board of Health structures in Ontario. Is there any municipality that has this structure that's being proposed in B, where there are citizen members on a standing committee that then reports to council, which is technically the Board of Health? Is there one other municipality that has the same structure?
Through the chair, so we did not go through each of the other 24, each of the regional boards of health to ask them exactly what their structure is in terms of members. So we would need to do so if in order to answer that question. I'm hesitating a little because I know when I was a resident, there was at least one that did, but I don't know if that continues to exist.
Okay, that's fine. Those are all the questions I had. Thank you.
Thanks. We'll move to comments now, and then we'll go to the vote. So I think Councillor Alex Wilson, you're on the list, and then I'm after you.
Thank you. I'm really supportive of all three of the recommendations within this report. And I do just want to speak to why I haven't been able to get involved at the governance committee level yet. So this is my first time kind of being able to speak to this now that we have that report. I really strongly believe foundationally in the principle, we keep ourselves safe, we keep our communities safe. And whether that is in responding to hate incidents, whether that is looking out for each other in public health promotion, whether that is organizing caremongering, as we've seen in the city, it's something that I know a lot of Hamiltonians believe in as well. And I think the results from this public consultation speak really clearly to the fact that community members see a really important step in keeping ourselves safe, keeping each other safe, as having a seat at the table. That makes sense to me. And I think it's hard when not all of us necessarily, without speaking to anyone's individual experiences, we all have different ones. And we've all had distinct experiences in Canadian society that's impacted our access to health. We heard from one of our delegates today that part of the reason they've been involved in advocacy stemmed from a personal experience. That's certainly my experience. I was an undergrad at Mac. I was 18. Having issues with transition, all those types of things that going to the Student Wellness Center. And I'm never going to forget the moment that when I was walking home with a prescription in my backpack, the thought occurred to me, wow, if I got stopped, if I was searched, whatever, that's going to impact how that interaction experiences. It wasn't a pressing deal. I'm not stopped regularly or anything like that. But I just realized that, wow, I knew the systemic oppression exists. I knew that we live in a world that treats some people differently. But once I crossed that line, once I was in that identity, suddenly I knew. Similarly, I'll say we know systemic oppression exists. We, in this country, incredibly so. We've heard about historical examples in health here. We have residential schools built on top of graveyards of children. There's clearly, we need to have changes in how we do things and move forward. And so we keep ourselves safe. is a really exciting moment for me, and that's what I keep coming back to. But I think there's also something exciting for our whole city, and there's something really exciting about Hamilton in this. There are 3 single-tier municipalities in Ontario that have half a million people in population: Toronto, Ottawa, Hamilton. There are 2 municipalities that have a semi-autonomous Board of Health: Toronto, Ottawa. As we move forward and as we think about our new relationship with the province, as we think about the new civic institutions we're building across all 3 levels of government, as our community comes together, as more residents in this country live in cities, cities must have a bigger role in our constitution at all levels. We don't control the constitution at the local level. We don't control the division of powers. But by asking for changes to the City of Hamilton Act on this issue, it helps us ask for future changes to the City of Hamilton Act. Because I think we all agree that that act does need to change. There are taxation powers we'd like that Toronto has. There are other types of things in that act that we'd like to go as we walk down our journey as a city. So if we want to take ourselves seriously, if we want to be the type of city that kind of expands what our authority is in terms of bringing those into the municipal role, becoming a little bit, closer to the people we represent and putting more power there, this is a really exciting move for local democracy as well. And so I want to note that it's coming from a place of equity. It's coming from a place of ensuring that we're representative of the community, but it's also coming from a place of giving local residents more say over the decisions that impact them. That's fundamentally the core of what I ran to do. Like I believe in that so wholeheartedly. So I am really excited about this. I think I've had personal experiences that make me understand firsthand. I've never been able to access queer healthcare professional, ever. That has impacted my access to care fundamentally. And so when we're hearing from other people that they want a seat at the table to raise those issues that they know intrinsically, to help us all realize some of those things that we know in our heads but we don't understand until they impact us exist in the world, I think the report speaks for itself. I think the consultation speaks for itself. And we can figure out the semantics later. But I do just want to make one point, because I think it is getting a little, I keep hearing this idea, well, what if citizens were there? What if citizens were there? There are members of this council that do not sit on every standing committee. So the first time they are meaningfully engaging with a report is at council. That is not how Board of Health works. I want to acknowledge that this is a difference for that specific standing committee. But we don't go, oh, I wasn't at council. Is my governance ability not there because I wasn't at the standing committee? And I don't see how adding citizen voices, regardless of whether or not council voices the minority or the majority, diminishes our role as councillors, because our role as councillors is not diminished when we don't participate in a standing committee today. We're still able to engage at council. And so I don't see this as that different. I do see it's semantically different, and I think we have to process through those semantic differences, understand how code of conduct works out. And semantics matter, but I don't know that they're the driver of this conversation. They're part of that journey. They're part of getting clear, and I think we do have to do that work. It's clear. We can be more clear, I think, based on this conversation today. But I am so confident that that is peripheral to the main concern here. And just, yeah, I'll finish up saying I'm so supportive of these recommendations. Happy to support.
Thank you. And next on the list is Councillor Spatafora, then Councillor Clark, and then myself. Councillor Spatafora?
Thank you, Chair, and appreciate the conversation that is happening here, and very supportive of the recommendations. The only question I would have, Chair, and I guess I will leave it to you, if I was looking to amend B, which is the actual makeup of the board, is that something that we could do now? Or, I mean, this is a decision that is going to go to council made and then debated without maybe half a council being there. And then having to have that debate to amend possibly at council. Is there a way to put that amendment on now to see if it has the support to bring it there?
I'd suggest, and it's up to the will of the committee here if you want to bring an amendment forward, but I would suggest that since this committee does not make up the majority of council, that if people want to bring forward an amendment to council, they could do it there. But if you want to bring the amendment here, it's your right to do so. I'm just saying that we could have the amendment on the floor of council just as well as we could have it here. There's nothing procedurally stopping either thing from happening. So I'm answering your procedural question, but I'm not opining on what you should do.
Okay, Chair, then what I'll do is I'll bring that amendment to, I'll speak with the mayor as well and bring that amendment to council. Thank you.
Thank you. Councillor Clark.
Thank you, Chair. I'll just make a few comments, and I hopefully won't take up my 5 minutes. I think sitting around this table, one of the things that I have learned over the years is that the dynamics of human nature is unpredictable. And while we may pride ourselves as being allies to communities that experience discrimination, both systemically and randomly, and just meeting people in a grocery store, we've seen issues like that. I think the intent here is to ensure that our Board of Health, which of all the committees that we have at the municipality, and I would argue even in comparison to City Council, the Board of Health, the Public Health Committee is the most important. We learned that very clearly, and I remember at the beginning of this term or last term when they started talking about merging all these boards of health and public health institutions together, that we would lose the autonomy and we would lose the intelligence on the ground in the community that we know best. We saw during the pandemic a breadth of opinion on something as simple as a vaccine. There was not unanimity. And around this table, we experienced it. But I think it's important that if we're going to have experts in public health sitting around this table, that they have those qualifications, training, and experience to guide us as we go through this process, to guide the medical officer of health as we are preparing the ways and means to battle the next pandemic. Like tornadoes, it's not a question if they're going to occur, it's just a question as to when the next pandemic hits and how strong, how aggressive, how virulent. And it's helpful, in my opinion, that we have that expertise around the table of the Board of Health, as well as on the front bench of our public health department. I think it will assist us. It will help us understand some of the complexities, but most important, our responsibility is the protection and promotion of public health. And that's what we need to keep focused on as we go through this process. So I have no qualms about the recommendations that are before us. If there is a need to change how the qualifications would be, regulated health professionals, I think we can find that balance. We have found collaboration around this table frequently, so I'm positive that as we move forward, we will find that consensus, if you will, as to how we move forward with the selection committee and with the people and the qualifications that are required to sit at the table. So thank you, Chair, for the latitude. And I do want to thank not just Peter, but also Dr. Richardson and the entire team.
Thanks, and if you could take the chair, Councillor Huang, I'd appreciate it. Yeah, I want to start by where Councillor Clark stopped. I really want to commend Mass LBP. I didn't speak with Consultant McLeod. I spoke with somebody else who she was excellent. I thought that this was an outstanding consultation. I've been parts of lots of consultations, and this one really stood out to me, and I wanted to say that. The questions were extremely incisive, thoughtful, and I think that the report really reflects what I heard from everybody I spoke to informally about it. And one of the things that we heard informally and then showed up in the report is that many of the members, current members of the Board of Health who are councillors, support this going forward. I think we had a pretty outstanding and broad community input here, not only from residents, but also former medical officers of health and folks from communities who may be disproportionately impacted by the decisions made by boards of health, which I think is really important. That's who we heard from in this situation. I think we have to be careful when we think about the composition here. I'm not going to opine on it or move an amendment today. If somebody wants to move an amendment at council and the majority of council say, well, if we want one more person on the thing, then that's the majority of council's decision. I don't think that should determine how we move forward here. I think that there's no inherent adversarialness between members of the community, education representatives, and members of council. So I don't want us to go down a road where we see factions, where we see, well, these individuals are going to be voting in opposition to these individuals, and there's somehow these strange voting blocks that have emerged. What I've seen through this process actually is exactly the opposite. I've seen many on council and the community align. And I think it's worth celebrating that. It doesn't happen every day, where we see the community coming forward proposing something, city staff recommending it, and councillors on board. That doesn't happen every day. So let's really celebrate this moment, make this happen, do something good for our community, and get in line with what other boards of health are doing. There are many boards of health. We are the anomaly with Hallam and Norfolk in not having moved to more autonomous models. Let's make the leap. I think the majority in council are ready to make that leap. There's some fine tuning to do. Great, I agree with Councillor Clark. We'll be able to do that fine tuning in a way that makes sense for everybody. But this is an important moment to celebrate. I'm really grateful for the work everyone's done and looking forward to the future of the Public Health Committee. Those are my comments. I see no further speakers on the subject at the moment, so we will go to the vote.
I have a point of order on the vote.
A point of order on the vote.
Yes. So recommendation B is a change to the structure and composition of a City of Hamilton Standing Committee. This standing committee does not have the authority to make that decision because that is now within the purview of the mayor with her strong mayor authority. This decision also fundamentally would impact the strong mayor authority in that when citizen members are added to a standing committee, the mayor as the strong mayor no longer has authority over that, the decisions of that standing committee. So I think that B, my point of order is that a decision by this committee today on B is out of order until such time as the mayor specifically defers or delegates her authority to this committee to make that decision.
I will turn to staff to respond to that point of order for the time being. Dr. Richardson.
Through the chair, and I'll turn to our city solicitor, Lisa Shields, who I hope is still online. But just I'll begin with, while she joins us, that this particular issue was the subject of some discussion over several weeks in terms of how to move it forward. And it was through that discussion that we landed on what you see before you today. And so that essentially it would look at, you know, the change in composition, and that would be the purview of council, but setting down the existing committees. I'll turn it over to Lisa in terms of the mayor's powers.
City Solicitor Shields.
Thank you. Through the chair, Councillor Danko is correct. Under the strong mayor's power, and it's referenced in the report, and I'm just trying to pull it up here, section on page, what are legal implications. It does specifically note that jurisdiction lies exclusively with the mayor in terms of being able to dissolve what are called prescribed committees, which is a committee consisting solely of members of council, which the Board of Health is. So what I think the recommendation suggests in B is to, just pulling that back up, is to recommend that a change be made to the membership of the Public Health Standing Committee. In terms of it being in order, it's a recommendation. Only the mayor can, to council, only the mayor, as Councillor Danko says, would be able to dissolve the existing committee to allow for that recommendation to come into effect, or can delegate such responsibility to council itself.
Thank you, City Solicitor Shields.
So the point of order is that this committee cannot approve a recommendation before the mayor delegates her authority to this committee to enable us to approve that recommendation, which is what's happened with the selection of committee chairs and is what we've been now doing as the standard for where committees are making decisions that are not in line with the strong mayor authority.
And I'll respond with how I'm going to rule as the chair about this. What I heard the city solicitor say was, quite clearly, we can recommend whatever we want. The actual thing cannot happen without the mayor's consent. So whether this committee recommends that and council recommends it to the mayor ultimately, it is up to the mayor. If the mayor wants to use her strong mayor powers to veto that, she's able to do so. But there's nothing that prevents us from making the recommendation itself, and that's what the city solicitor said. I trust her. She's a city solicitor on the subject. They've reviewed this ad nauseum. I'm not going to go in a different way here than what they're suggesting. From a legal perspective, I'm not a lawyer. On that, we can go to the vote.
Sweet.
And that vote is up. And on the recommendations, it carries 8-0. Just a moment while I go back to the roadmap to make sure I don't make a mistake. We're on to discussion items. And 10.1 is the first one, which is the Hamilton Public Notice Policy Bylaw, FCS 23080A. And this was referred from our previous governance review subcommittee meeting. May I have a mover and a seconder to put the report on the floor? I see Councillor Taddison and Councillor Alex Wilson. Are there any questions for staff on the report? Go to questions first, then debate. I see Councillor Clark and Councillor Maureen Wilson. I'll add myself to the end of the list if they don't catch what I was going to say, but otherwise, Councillor Clark and Councillor Maureen Wilson, go for it.
Thank you. Excuse me. Thank you, Chair. I'm looking at Appendix A, item number 10. It indicates that at least once a year, the city clerk shall cause a notice to be published in a newspaper having general circulation, yada, 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 to explain where the residents can find public notices. My suggestion would be circulation on newspapers are shrinking faster than my hair follicles. And I'm concerned that we're not hitting the mark when we do our advertisements. So I would like a comment from staff with regards to requiring that this same notice, maybe paraphrased somewhat, would be mailed to every house once a year, every business once a year, to ensure that the residents of Hamilton know where to go to become engaged with their municipal government. Because as it stands right now, when I'm out and having meetings and talking to people, they don't know where to go to find this stuff. And I don't think advertising in the newspaper is making a hill of beans these days. So is there a way of us doing that? I point to what we did with the planning committee with the urban boundary expansion, and we had overwhelming success. But more importantly, we mailed it to every household. So people couldn't say to us, I didn't know. It was mailed to every household. Chair?
On hills of beans and other things, who would like to answer? Acting City Clerk Janet Pilon, go ahead, please.
Okay. Through the chair, sorry. That is the option that we have in the bylaw to publish a notice in the newspaper. We can go away and consider other options, such as maybe putting it on our electronic displays that we have throughout the city, that notices can be found, public notices can be found at such and such on the website. That might be another option, so that someone driving by a electronic digital billboard would see it. We have billboards. I'm just looking at cost efficiency And I think that would be a lot less expensive than a mail out. But if you want to direct us to look at options for that, we can do that.
Thank you for that, Chair. I recall concerns about cost coming up when we were dealing with the urban boundary expansion, and the costs were a fraction of what we thought it was going to be. So I don't know how to proceed here, whether or not I should be amending this or requesting an amendment to this to have that fully looked into. But I am concerned. We have a priority that we have published as a municipality that we are going to improve civic engagement. We need to live up to that, even if there is a cost. I look to you for advice.
And I look to you, Acting City Clerk Pilon.
Through the chair, we could elaborate on item 10 and put published in a newspaper and in multiple other venues. And that way, we're not limited to just the newspaper.
I think that would be helpful in 10, and I think what I could do is move a separate motion at the appropriate time that we get the costing and come back with that report and go from there. I don't think we should jump to amending this here. I like the idea of other venues. It gives us that latitude. But then we could look at it offline and come back with a motion that would make sense if that's reasonable to you, Chair. So that would be a friendly amendment here that in other venues or wherever the clerk feels it should go.
Yep, so that was amended by staff on the floor, and that's totally fine. They can amend their own recommendation if they wish to do so. And so they've done so, and they'll change that little thing. And then when the appropriate time comes, we'll come for an amendment to the whole body of the report, adding something else for a report back to us here on the costs of doing mail-outs. And then we can vote on that separately. Vote on the amendment and then vote on the recommendations as amended. On that note, I see now Councillor Maureen Wilson had some questions about this.
Thank you. I just want to make sure I am understanding correctly some of the premise that's informing the action. Could someone clarify for me? There was, and again, I'm sorry, I can't find it. There was reference in the report that consultation revealed that folks would prefer or would favor notice electronically and otherwise as opposed to newspaper. Could I ask someone to elaborate on that feedback? Thank you.
Turn it over to whoever is in a position for elaboration. Acting Clerk Pilon, thank you.
Through the chair, I consulted with the departmental staff on the changing the public notice, and they all provided their comments. As far as public consultation, I have not done that. It may have been part of a communications survey, but I did not do it, and I don't think it's in the report. The consultation was just with departmental staff.
Through the chair, beg your pardon. I thought I read a reference that as a consequence of Engage Hamilton or something, and the root of my question is, in getting that feedback that is supposed to support this movement, was that feedback received by individuals who are able to give their opinion vis-a-vis an electronic platform, or is that something that we received in another way? And I'll try to explain. I'm trying to understand whether there was an inherent bias in how the opinion was given. If we're asking people to give an opinion and they give that an opinion via via a electronic platform, then that opinion is necessarily predisposed to those who are already able and have the practice and routine and means to give and get notices from an electronic platform versus maybe other individuals, whether due to income, age, where they live, rely on a paper format to get their information and their public notices. I'm trying to understand. I'm pretty sure I read that and what the root of that feedback was to determine we can go elsewhere. Through the chair.
Through the chair, the communications announced a newsletter service allowing residents to have city updates delivered directly to their inboxes. So that's an option that has been used by some of the residents of the city of Hamilton.
Could I maybe help this a little bit in clarifying? I think what you're asking, Councillor Maureen Wilson, is how are people engaged about this from the public's perspective, right? So if there was an Engage Hamilton survey, for an example, right, and that we engage people through, inherently, if they're engaging through Engage Hamilton, that's primarily done online. So automatically, if they're engaging online, they may be predisposed to saying, hey, I could be informed online. Did we engage people through the paper? Did we engage people in other kinds of formats when we did this, or did we just engage people through Engage Hamilton? Or did we engage them at all publicly? And the answer I'm getting is I don't think we did a public engagement, but I'll have the acting city clerk let us know.
Through the chair, there was no public consultation.
Thank you very much. I understand that we have a worldwide, including in Canada and in Hamilton, a shrinking audience for newspapers. My next, and if there is no engagement, therefore, I'm supposing that there was also no engagement with the newspaper companies on what this would mean to their business. May I ask that through the chair?
You may. Were the newspaper companies consulted on this?
Through the chair, the communications did speak to the newspapers. However, we do still have the legislative responsibility to publish some of the notices. So there are only the notices that are referred to in the bylaw that are required to be on, like that we're going to change and put on the website. The others are legislated through the Planning Act, through and other acts, and we still have to publish in the newspaper for those.
Thank you. Through the chair, I appreciate that. What we're talking about here is there are those things under legislation which we are mandated to give notice and put that in a newspaper publication. There are other bits that it's not mandatory. It's optional for us. And we have been using the printed media to advise people of what's going on in the city, one thing or another. I guess the root of my questions is to understand better in my due diligence of whether there was an inherent bias. And I'm not discounting, Chair, the importance of the cost. But I am trying to understand. I do know that there are still a number of Hamilton residents who do read, in this case, The Spectator, who do rely on the newspaper to be apprised of what's going on in their city. And respectfully, I don't know if Burlington, Oakville, Mississauga respectfully have a daily newspaper, and they may have been easier for them to move in that direction. And these are the essence. This is the essence of my question, is trying to get at an understanding of who's informed this decision Is it those who already get their information electronically? Or did we include that net to include those who may be out in the cold when it comes to that? Thank you.
Yeah, and just to answer your question, we did not do any public engagement period on this, so that gives you a broader sense. If you'd like to refer this report back for public engagement, that could also, dovetail with what Councillor Clark was saying with respect to earlier about getting costs for a municipal mail-out. Like, you're well within your rights to bring that amendment at a time you see you're the last speaker on the list for this item. So if you want to refer it back for public engagement through online and print media, you're welcome to move that motion, and we can throw Councillor Clark's amendment in there. So I'll leave it to you.
Sorry, beg your pardon. Am I the last speaker, or because I don't want to?
Yes, you are the last speaker. Yep.
Okay. I don't know how to word the amendment. I just want to make sure I'm doing my due diligence to understand the implications of this for all Hamiltonians in their capacity to receive the kind of notices that we are putting in on a volunteer basis, so non-mandatory notices in the print media. I'd also like to understand what the implications, we're not going to be able to save the newspaper business, but I would like to understand from the newspaper business what the implications of this are to them, if they would have an opportunity to speak to that. We're not obliged to save them. They're a private entity, but I would like to give them the opportunity to speak to them. So I guess my amendment would be to clearly understand from maybe the communications department who and how they were informed by this information, and what opportunities will take their place, and see if we could engage with the print media on this proposal. Thank you.
I think I have your motion in my head, and I'll read it out from my brain, so bear with me. I think what you want to do is you want to refer the report back to staff to do 3 things. Number 1, to do public engagement through print and online, and have a public engagement period so people can report back about what they think about this. Number 2, that you want us to engage with our media partners to ask them about the impacts of this policy on them. To the extent that they're willing to report back to us, it's going to be up to them, but we can engage with our media partners to ask them what the impact will be. Some may wish to participate in telling us the answer. Some may wish not to. That's up to them, but we can give them the opportunity. And then 3, Councillor Clark's amendment, which would be just to also say that we'd ask for costing with respect to annual mailouts.
Thank you.
Under this policy. So if I capture all 3 of those things and Councillor Clark doesn't mind seconding it, then we could have that as a motion to refer. If you're okay with that, Councillor Maureen Wilson. Okay. I'm not putting the motion. Councillor Maureen Wilson is putting the motion. I'm just reading from my brain. Councillor Clark is the seconder. I'm saying this in a kind of cadence to allow typing to take place, just in case Elsie Bates requires that time. Elsie Bates, do you have that down? I don't need to see it. I think we all understand. But do you have enough information for yourself to be able to compose the minutes in a way that's
I am
satisfactory?
going to put it up just for clarity on
Wonderful.
Councillor, the 3rd piece. So if you bear with me for one moment.
I think everybody in the room understands what that means. I think that staff understand what that means. I'll look for a nod just for my own sentiments. Yep, there was some nodding. So on that, if it's okay, we'll vote. Moved by Councillor Maureen Wilson. Wait, there's some more modifications coming here. Great, so that's good. Councillor Maureen Wilson, can you audibly just say if that's okay with you?
Yes, I really appreciate Elsie Bates' efforts and work on that. Thank you.
Okay, that's on the floor. We will vote to refer. Just a moment, Legislative Coordinator Bates is communicating with the robots, and soon we will have the vote. And that vote is up. And it carries 8-0. And now we're going to move on to our next item on the agenda, which is the Office of the Auditor General's Work Plan 2023 to 2026. May I have a mover and a seconder to put this report on the floor? Moved by Councillor Alex Wilson. I'll second that. So it's on the floor. Any questions for staff on this report? I see Councillor Alex Wilson. Take it away.
Thank you. Just a quick comment. Seeing so many of the issues listed in this report are issues that we're having constituency work done or big flags. I just particularly want to go towards some of the housing work that's happening in 2024. I think some of the questions that have maybe been asking staff already are going to be potentially answered in this audit. It's a chance for us to bring the breadth and that holistic scope. Like, there's an operational team that's doing those operations questions, and sometimes we as the governing table have questions about value for money or other types of things. And so just really, really appreciative that we do have an organization that has an auditor that is doing those audits, and that can connect back to the policy work that we're doing as well. Not so much questions, just as I think these are really well chosen. I think personally, I'll say they're fitting to the needs we're getting in our community, and excited for these audits.
On audit excitement, I appreciate that. I don't see other speakers on the list at this time, so we will go to the vote on this item. And just in case no one heard that, with thanks to the Auditor General from Councillor Clark. That vote's up. That carries 8-0. And just as a time check for everybody, it's now noon. There is still some more, using horse metaphors, trotting and galloping to do through the agenda. So just want to let everybody know we're almost there, which gives us sufficient time for a changeover, hopefully for our staff. We're on 10.3, compound water meter billing issues. FCS 23110, may I have a mover and seconder to put the report on the floor? See Councillor Taddison and Councillor Alex Wilson's hand is up above the shoulder, so that indicates seconding in my book. Any questions for staff on the report? Any comments for staff? Okay, we can go to the vote. And that vote is on the screen. That carries 8-0. Notice to all my colleagues, if your hand is above the shoulder height, I may suggest you as mover or seconder at this time in the meeting. So warnings to fingers on eyebrows, hands on temples, they'll count. Now we're on to the Hamilton Municipal Cemeteries Trust Fund Audit Management Update, FCS 23090 and PW 23078 citywide. Can I have a mover and seconder to put this report on the floor? Councillor Alex Wilson and Councillor Mike Spadafora. Are there any questions for staff on the report? Not seeing any questions, we'll go to the vote. With thanks to our Auditor General and others. And that vote carries 8-0. We're on to 10.5, the Land Parcel Master Agreement. So there's a single recommendation here, but I need someone to move in second. Let me get that on the floor. Moved by Councillor Spadafora, seconded by Councillor Huang. Are there questions or comments on the Land Parcel Master Agreement? I see Councillor Maureen Wilson. Take it away.
Thank you. Just a wonky question of interest. There was reference, I'm sorry, I can't find it. Oh, there was a reference to the possibility that was presented by this TerraNet thing, and I just wanted staff to have the opportunity to elaborate on the possibility that was offered because I didn't understand it. Oh,
Is your question about, Councillor Maureen Wilson, is your question about whether or not we would go with a different provider potentially, or?
no,
Okay,
no,
go
no,
ahead.
thank you, Chair. It was a question of substance on what the Terranet stuff provided us. Listen, I don't want to take up any more time. I can ask the question offline. It's just a nerdy question. Thank you.
No problem. Thanks for your grace in taking it offline. I'm not seeing other folks here, so we will go to the vote. And that vote carries 8-0. And we're now on to item 10.6. A 2024 City Enrichment Fund advance payments and 2023 payment update, CM 23030. May I have a mover and seconder to put this item on the floor? Seeing Councillor Huang and Councillor Alex Wilson. Are there questions on the advance payments and payment update report? Not seeing a hurry of hands, we will go to the vote. And that vote's up. And that vote carries 8-0. 2 items left in this section, everybody. We have item 10.7, which is the Indigenous Advisory Committee 2024 Budget Request, HSC 23077. May I have a mover and seconder to put this report on the floor? I see Councillor Alex Wilson and Councillor Mark Taddison. Any questions for staff on this report? Not seeing any, we'll go to the vote. That vote carries 8-0. We're on to 10.8. The Procurement Subcommittee Report 23001. I saw quickly hands up from Councillor Alex Wilson and a hand above the shoulder from Councillor Huang as a seconder. Are there any questions for staff on the Procurement Subcommittee Report? No further discussion on that. We'll go to the vote on that. That vote is up. And that carries 8-0. Now we're on to general information and other business, which is item 13. I have an exciting note to share with you. These are amendments to the Governance Review Subcommittee, OBL, and were among the items that were referred from that meeting. So are there any questions or on the amendments to that outstanding business list? Okay, I will need a mover and seconder, Councillor Alex Wilson and Councillor Huang, and we'll go to the vote. Okay, and that carries 8-0. We're on to item 14. Now this is really a choose your own adventure, as we often have here. If people would like to go into the private session to discuss the report in detail, we can do so. You have it before you. I'll look around. If nobody wants to go into the private session, then we will just move and second it in the public. Okay, not seeing anybody who wants to go into closed session to discuss it. So I need a mover and seconder to approve the open session recommendations in the report. I see Councillor Spatafora and Councillor Alex Wilson. We'll go to the vote now. I'm happy to bear with you. Yep.
Alex Wilson, Councillor Crouch, Councillor Huang.
Councillor Alex Wilson's in favor. I've now voted. The vote has been up. That carries 8-0. We're about to get to adjournment. And Councillor Chattison's hand electrifyingly fast on that motion. Before we go to adjournment, though, briefly, just want to say thank you. It's been a lot of fun, frankly, at what is often deemed one of the most boring committees of the city. I've had a blast as chair for this year. I won't be pursuing being the chair next year, so look forward to whoever takes on this work. It's been a pleasure and a lot of fun, frankly, so thanks.
Thank you, Chair.
I just wanted to put on the record, I thought you did a remarkable job as chair. Being a new member of council, you learned incredibly fast. Your ability to comprehend the issues and help us get through it was very much appreciated. So thank you, sir.
Thanks for the kindness. You're very welcome. Councillor Huang?
I think the next incoming chair is going to have some big shoes to fill.
Maybe, that may be self-referential, and my excitement is real about that, so glad to hear it, Councillor Huang. On that, we have a mover for the adjournment, which is Councillor Tattison, and a seconder to adjourn, Councillor Alex Wilson. That motion to adjourn is up on the screen. Councillor Huang is in favor of adjourning. And that's it. We're adjourned. Have a great day.
Thank you, Chair.